Video 62, Tailoring Messages, Segmentation, Area 6 CHES Subcompetencies 6.2.1. Review the learning objectives for this video. Welcome to this video on audience segmentation and message tailoring. These are two essential communication strategies that every health educator must understand for both the exam and your professional practice, and I think you are going to find them genuinely fascinating. Audience segmentation is the process of dividing a larger population into smaller, more homogeneous subgroups that share certain characteristics. Think of it as sorting your audience into meaningful categories so you can communicate more effectively with each group. Message tailoring takes this one step further. While segmentation groups people together, tailoring customizes the actual message content for those specific subgroups or even for individuals. Here is something that should encourage you. Research consistently demonstrates that tailored health messages significantly outperform one-size-fits-all generic messages when it comes to changing health behaviors. A study published in the American Journal of Public Health found that participants who received tailored print materials were significantly more likely to adopt recommended health behaviors compared to those who received generic materials. So the skills you are building right now will directly improve your effectiveness as a communicator. The foundation of effective segmentation is solid data from your needs assessment. You cannot meaningfully segment an audience if you do not know their characteristics, needs, preferences, and barriers. This is why Area 1 of the competency framework, assessing needs, directly feeds into effective communication strategies here in Area 6. It is also important for you to understand the distinction between targeted messages and tailored messages. A targeted message is designed for a specific subgroup and is the same for everyone within that group. A tailored message goes further by customizing content based on individual characteristics within the subgroup. Both approaches are more effective than generic messaging, but tailoring produces the strongest results when resources allow. Now let us compare the two primary approaches to segmentation that you will encounter on the exam, and understanding the difference between these two is going to serve you well. Demographic segmentation divides audiences based on observable, measurable characteristics. These include age, gender, race, ethnicity, income level, education, occupation, and geographic location. Demographic data is relatively easy to collect through surveys, census records, and existing databases. For example, you might segment your audience as women aged 18 to 34, or adults with less than a high school education, or Spanish-speaking residents of a particular county. The advantage of demographic segmentation is its simplicity and accessibility. However, the limitation is that people within the same demographic group can have vastly different health beliefs, motivations, and barriers. This is where psychographic segmentation becomes so valuable. Psychographic segmentation addresses that limitation by dividing audiences based on internal characteristics such as values, attitudes, beliefs, lifestyle choices, interests, and their readiness to change a specific behavior. This approach draws directly on behavioral theories like the trans-theoretical model and the health belief model, which you may already be familiar with from earlier studies. For instance, instead of targeting all parents, you might specifically target parents who are motivated by child safety concerns and are in the contemplation stage for getting their children vaccinated. Psychographic data is harder to collect because it requires surveys with attitudinal questions, focus groups, or in-depth interviews. However, it is far more predictive of actual behavior change. Here is the key insight I want you to take away. The strongest communication strategies combine both approaches. You might identify your demographic segment first, then further refine it using psychographic variables. This layered approach ensures your messages are both reachable and resonant, and that combination is where the real magic happens in health communication. Now that you understand the theory behind segmentation, let us talk about how to apply tailored communication in real practice, because this is where your knowledge starts making a real difference. The first principle is to match your message content to where your audience is in the behavior change process. If your target segment is in the pre-contemplation stage, your message should focus on raising awareness and building perceived susceptibility. If they are in the preparation stage, your message should provide specific action steps and build self-efficacy. Using the same message for both groups would be ineffective. The second principle is cultural relevance, and this is something you can really excel at when you put your audience first. Tailored messages should include images that reflect the audience's community, language that matches their preferred communication style, and examples drawn from their lived experiences. This goes beyond simple translation. It involves what researchers call deep structure cultural adaptation, which means addressing cultural values, beliefs, and historical experiences that influence health decisions. Third, your tailored message must address the specific barriers your needs assessment identified for that segment. If cost is the primary barrier for one group and transportation is the barrier for another, each group should receive a message that directly addresses their particular obstacle. Fourth, you should select the delivery channel that your target segment actually uses and trusts. Younger audiences might respond better to social media and text messaging, while older adults might prefer printed materials or community-based presentations. Choosing the right channel is just as important as crafting the right message. When you combine all four of these principles, you create communication that feels personally relevant to the audience, and personally relevant messages are far more likely to drive meaningful behavior change. You are learning to communicate in a way that truly reaches people where they are, and that is one of the most rewarding skills you will develop in this field. Read the scenario stem aloud. Give students 30 seconds to consider options before advancing. The correct answer is B. Option B correctly applies both segmentation and tailoring principles. The young adults in pre-contemplation need messages targeting perceived susceptibility, while the middle-aged adults in preparation need messages building self-efficacy. Option A uses a generic approach that ignores segmentation entirely. Option C abandons a significant portion of the population. Option D relies only on demographics without tailoring the message content to psychographic differences. Summarize the key takeaways before